So before we get started, I want to talk just briefly about the work that we're doing. So this whole program we're doing is all digitally based. So this is like social media on a whole nother level. But before we can even address anything with social media, and I think I've seen this and I've heard people talk about it, is I had to make sure my staff was right. I have a pretty diverse staff. I got two of my staff members here, Derek and Ryan in the back. But our staff represents our community, which makes it a lot easier for us to go in. I just want to go ahead and put that out first, because I think people don't realize how important it is for people receiving services to have people that they can identify with.
So when we look at identifying, we have a mother of the group, we have a person that's bilingual, we have another mother of the group. That keep the kids in line. So basically the problems. So the way social media was back in the day, you look at between the 80s and 90s, social media was very scarce. You look at television, the newspaper, which my mom lived by now, because she look forward to looking at the newspaper on Saturday morning just to see who died in the community. So the obituary is kind of her thing. So it kind of integrated the Google app for, but Google Home for her, so she can have access to, just in case that be diminished pretty soon. But as far as it relates to our target demographic, we try to make sure that we ask our clients what they need first before we start providing service for them. And at the end of the day, we don't want to have money wasted on things that they don't need.
So with that, we did a small focus group, and we asked the community members how they want to be reached. If you look at a lot of ads that target MSM of color, they usually, I think a lot of them are overly sexualized. So we got together a group of young people and asked them what they thought. They didn't want the ads to be too sexy. They wanted them to be straight to the point. They don't want a whole lot of yip-yap. Tell me what you want, tell me how to get it, and they're going to go on about their business. Men who had sex with men of color in Birmingham that we talked to felt overly targeted. Anytime we talked about anything concerning HIV, there was always a black gay guy. And they kind of felt like they were being a little overly targeted on that. And also, and I know none of you do this, but for people who are on hookup apps, like the last thing you want when you're trying to hook up is to see an ad about PrEP or safe sex. Like, that's a foregone conclusion. Nobody really, that's the wrong time to target people. So with this particular project, we decided to target people, where they wanted to be targeted.
So campaign objectives, as she stated earlier, we're not going to go over it, but the whole point is to find the cure, to find the service that we need. We already have, being in Birmingham, we have the services that clients need. The point is just trying to find the clients to issue the services out. We do have rural areas that, like the Jaspers of the area, where that clients are not receptive to it. But for our Jefferson County area, we're able to reach out for 40 miles outside the jurisdiction. So that actually gives us a location of what target areas we need to go at. Now, as far as the social media aspect of it, this is where his job comes into play. I'm the nuts and bolts of the project. When it comes to social media, I have no part in it. I'm just letting y'all know that right now.
He ain't even got a Facebook page.
Exactly. I don't have time for it. So when it comes to the issues, I need him to tell me what we need, and we go from that point.
So, like Trevis said, it's a whole thing about, you can lead a horse to water, but can you make him drink? We couldn't find the horses because the people that we're trying to reach, they don't want to be found. We live in the buckle of the Bible Belt in Alabama, where there's a church on every corner, and there's a whole lot of gay bashing going around. So even when you're talking about engaging people in care, there's a whole lot of coming to Jesus, for lack of a better word, that people have to do with themselves before you can really even engage them. So we decided to use the internet. So Google has about 5.9 billion searches every day. So people are always searching for something. With that, and you've heard a lot of it now with the whole thing going on with Cambridge Analytica and what happened with the 2016 presidential race, they keep a lot of information on us, a lot. And if you're using it for nefarious purposes, that's one thing. We were not using it for nefarious purposes. So what we were doing is we were actually taking people's searches and also tying it back to their demographic information. So we were able to identify our targets through demographics and income, the device type that they were using. So we knew if people were searching for HIV and HIV-related things on cell phones, tablets, even computers. We also were able to get their geographic information, and also we used some partner networks with Bing and Google. So, as we said, we're in Birmingham, but when you're on the internet, you really don't have any boundaries, right? So we were able to reach people as far as Meridian, Mississippi, Dothan, Alabama, which is in the far southeast quadrant of the state, Columbus, Georgia, whole another state on the other side, Huntsville, which is the northern portion of Alabama, Mobile, and Montgomery, with the work that we did. Social media, when people talk about things going viral, you know, if I know someone in Mobile who clicks on the ad and maybe share it, then they got people in Mobile who are looking at it, and it goes from there. Okay, so numbers. The average person spends about 37 minutes on social media a day. That's the average person. I probably spend way more than that myself. These are things that we know. Display advertising. We see displays all the time on all of our social media. A lot of times they're just right there in your face, and a lot of times they do things that are a little bit different. With the Facebook ads, they are what they call image-centric, which means you have a big image with pretty much nothing, and then you have the information below it. If you've ever tried to do any promotion on Facebook, if you have an image with a bunch of writing, they're going to tell you no. Retargeting. 98% of people who visit a website for the first time do nothing with it. Have you ever searched for some shoes and then you like, well, I can't get them today. But then when you go on Facebook or Instagram, bam, there those shoes are in just about every ad that you see. We did the same. We pretty much did the same thing with HIV. So if you search HIV or if you search gay clubs, anything in those areas, we did search engine optimization where we're able to target those words. So whenever you did that, those ads followed you back to your social media page. So the other things that we were able to do is data capture. We were actually able, when you use your cell phone, they do what they call digital masking. If you've ever searched for something on your phone and you press the button to call, it looks like you're calling that number, but actually it's a masked number that you're calling. So they're actually able to, and I'm gonna show you the numbers on there, we're actually able to know who called our offices, and we could track them back to the social media that we're able to do. For people who use computers, cookies track everywhere you go. Now your location finder on your phone does the same thing. So we know where a person is, we know where they're being, and we can almost predict where they're going. This was very important when we did geo-targeting for ads. We could literally draw like a polygon on a map and send out a message specifically to those people in that area because of their phone IDs. 38% of media interactions happen on smartphones. We can't live without our smartphones. So here's some of our results. We had 873 visits to our website. Game Changer in Birmingham, which is the name of our project, has a website. It's a pretty basic website, nothing important. I mean, nothing's flashy. It's all important. But the URL is gcbham.com, and we were able to get 873 unique visitors to that site, and we're able to quantify that. And this says from January to December, but actually we didn't get the site up to June. So we got these unique visits from June from our display ads, and we also got almost 600,000 impressions for people who are internet savvy. That's just the number of times that could be seen. These are not unique visits, but over 500,000 eyeballs got on that website. With the search engines, we were able to get 17,000 impressions from just people searching for HIV-related things during that time. I'm going data. Damn. We were also able to know that we had 92 unique calls from those ads. It actually shows how long the calls were. So if someone may have called in and say, hey, what's your address? I want to come in and get a test. Or what time do you close? So we could actually track how long the calls were as well. So we were able to get over 2,600 visits from the website, from Facebook ads. Again, all this happened between June and December. So these are our program results. For a startup project in a small city like Birmingham, I was impressed with this. So Trevis is going to tell you what all this means for us.
So basically, we had a total of 50, right now for this fiscal year, we have a total of 553 HIV tests that's done this year. In relation to our direct services, I'm not going to go over the list because I know we're running out of time. As it relates to our direct services and social media, we actually had an app that actually was just put together within the last week. So with this app, it's more of an interaction thing for our clients. So it's called the Game Changer Project app. What you can do is look at Q&A questions, is actually answer HIV basic one-on-one questions. And also for our events and some of the things, the services that we provide, our clients are able to click on. And so to keep retention for our clients coming back for some of the services, they actually click on our staff and actually can allow them to use the passport, which allows them to stamp with every events that they take on. And so everything that they do is incentive-based. So whether it's small projects or either larger things where they develop in some of our social services and some of our can't even say it, our preventive health
Activities.
well, not activities, but our preventive health and social cognitive skills and POL. So basically, that's what it does.
One more thing, and then we're going to go. So a couple of things I do want people to realize. We had a total of 5 people who came in just last week who we identified as HIV positive. We just relaunched this again this year. We also, of the number of positives that we identify, 60% of them just walk in. So we're not really identifying people at events. In Birmingham, and I think most other cities, people don't want to do testing in clubs anymore. They think it's too intrusive. So having people walk through your door is really, really important. And I was just really surprised when we looked at the numbers of people who actually just walk through the door and get tested.